welcome back to Neuronify. This is yet another video on forensic thanatology, important questions of our FMTUT series, and I hope you people are understanding the previous videos. And for this video also, I want you people to just listen to the lecture properly, as it is going to help a lot in revising the questions of FMT. So, as I say every time, without wasting a single second, let's begin the session. Starting with the very first question, which is post-mortem cooling. What is the role in determining time since death? So very first thing, we have to write the definition. Every time, remember, in every question, start with the definition, then causes, then features, and medical legal importance. So very first is definition. After death, the dead body behaves like an inert substance, and therefore if atmospheric temperature is low, body loses its heat by conduction, convection, radiation, and evaporation. So as to maintain the atmospheric temperature, that is, the body cools. In simple words, just understand, after death a body becomes an inert substance. What do we mean by inert substance? Just like a non-living thing with no metabolic reactions happening underneath. So what they're trying to say, whenever, see, there is a concept of post-mortem cooling which we'll be reading further, but I'll explain you. Before the molecular death, okay, molecular death do not occur instantly. It occurs after 1 to 2 hours after death. So in that period, there are certain chemical reactions which are going inside the body even though the person is dead, and those reactions are responsible for the maintenance of body temperature, which was already 37 degrees Celsius, with respect to the environment temperature. So there's a theory, we all know, that there is principle of equilibrium. The heat transfers, there is transfer of heat from more higher temperature to the lower temperature, right? So body's temperature when the person is living is 37 degrees Celsius, but when the person dies, it tends to cool down. The body tends to cool down because of the transfer of heat due to the principle of equilibrium. So that is the case in post-mortem cooling, and the other name of post-mortem cooling is alga mortis. No cooling of dead body occurs if the atmospheric temperature is higher than that of the body. Normal body temperature is 37 degrees Celsius. A fall in body temperature by more than 10 degrees Celsius is a sure sign of death. Now, how we are going to measure the temperature in the dead body? By chemical thermometer. And chemical thermometer, remember, is 25 centimeters long and has alcohol in it, and it has a scale of 0 to 50 degrees Celsius. The thermometer is inserted about 10 centimeter deep in rectum, vagina, nose, ear, or under liver. It is kept there for 2 to 3 minutes and is read when the thermometer is still inside. And remember not to insert the thermometer in sodomy patients. So, how you are going to calculate time since death from temperature? There is a formula: normal rectal temperature minus observed rectal temperature divided by rate of fall of temperature per hour. Now, what do we mean by rate of fall of temperature? See, there are 4 opinions regarding the rate of fall of temperature, exactly how the temperature falls in a dead body. Most widely accepted view is that rate of cooling in India is 0.5 to 0 degrees Celsius per hour, so that the body attains the atmospheric temperature in 12 to 15 hours. Second, as per another view, cooling is faster in initial period when the temperature difference between body and atmosphere is maximum. Third opinion, in second opinion, in first 2 to 6 hours, rate of cooling is 2 to 2.5 degree Fahrenheit per hour. Next 6 hours, 1.5 to 2 degree Fahrenheit per hour, and later on 1 degree Fahrenheit per hour. So external surface cools in 12 to 15 hours, but internally it requires 18 to 24 hours, and even up to 40 hours in obese. As per another view, body cools by half of the temperature difference between body and atmosphere every 2 hours, and whole body cools in 12 to 15 hours. At a particular place and at a particular time, rate of cooling of dead body can be known by taking 2 consecutive readings after 1 hour interval. The difference is the rate of cooling per hour. So these are the 4 opinions regarding the fall of temperature, but you just have to remember the definition, the measurement of temperature, and few points about the fall of temperature. Now, time required for cooling. Body starts cooling after 1 to 2 hours of death and attains the atmospheric temperature in 12 to 15 hours, while internal body parts take 18 to 24 hours to cool. So we have got inverted S-shaped curve for this. Now I'll explain why. Very first thing, as I told you earlier in start of the video, after death of the body, there is no sudden death of molecules present. We call it as molecular death. So there is no sudden molecular death instantly after the body dies. I mean, instantly after the death of the person. What happens? It requires minimum 1 to 2 hours for the molecular death. So in that time period, there are certain reactions which conventionally tend to take place in those 1 to 2 hours. So what happens in that time period, the temperature is still maintained to 37 degrees Celsius. Now you may ask why? Because those are the reactions which help to maintain the temperature of body by some maybe exothermic reactions. So release of heat leads to the increase in temperature and maintenance of temperature, but only for 1 to 2 hours. Now what happens after 2 hours? After 2 hours there occurs molecular death. Fine. So molecular death means no metabolic reactions, no chemical reactions taking place inside the body, which eventually means the temperature of the body is going to fall down now. So that is only what they said here. Initially, that is before the molecular death, the rate of cooling is less. Now why less? Because temperature of body is itself maintained in those 1 to 2 hours to 37 degrees Celsius. That's why there is no question of rate of cooling. But within 3 to 12 hours, the cooling is very fast, and again after 12 hours, the rate of cooling is very less. Now what do we mean by this? See, after 1 to 12 hours, that is within 3 to 12 hours, now the molecular death has occurred. So obviously now the temperature difference between the body and the environment is going to be very large, because the body has now turned into an inert substance. So where there would be transfer of heat from higher temperature to lower temperature. So from 37 degrees Celsius there would be decrease in the temperature further. That is why they said the rate of cooling would be very fast, because of large temperature, high temperature difference. And again after 12 hours the rate of cooling is very less, as the body temperature is almost close to environment. This is principle of equilibrium. Thus the shape of cooling is a sigmoid curve, which is inverted S-shaped curve. So now I think you people understood the point why it is inverted S-shaped curve. Coming to factors influencing cooling of dead body, what are the factors? Age. Body of small children and elderly cools faster. Why? Because they have less muscle mass. Number 2, general conditions of body. A thin and lean body cools faster. Then sex. Usually body of male cools faster. Clothes. A clothed body or body lying in bed cools slowly, because clothes act as a barrier. Atmospheric temperature. Rate of cooling is directly proportional to the temperature difference between body and atmosphere. Type of death. In sudden death, cooling is slow. In death due to chronic diseases, cooling is faster. In some conditions, instead of cooling, body may gain heat for some time, and this phenomenon is known as PM caloricity. So in some conditions, instead of losing temperature or instead of decrease in temperature, there is increase in the temperature, and this phenomenon is called as post-mortem caloricity. Now you are going to tell me in which poisoning it happens. So, and seventh factor is try to find out. And in surroundings, cooling is faster, strong air currents are present, and cooling is faster in dry weather also. Now rate of cooling is very important. We compare rate of cooling in water, air and soil. So in water it is fastest, then we have air, and then we have soil. 4:2:1. Remember the ratio. If body at sub-zero temperature, body becomes hard due to formation of ice in cavities and blood vessels. Sutures may separate. And now what is the medico-legal importance of algar mortis? Cooling of dead body is a sign of death. Time since death can be approximately known, and PM caloricity may result in some cases. Which cases? Poisoning cases. So this was all about the algar mortis. You have to define algar mortis, then you have to write how to measure it, then you have to write the rate of fall, then time required for cooling, factors, and medico-legal importance. Coming to brainstem death, how you are going to diagnose it? Brainstem death can be diagnosed by a person must be in deep coma for at least 6 hours, absence of any typical postures due to decortication or decerebration, no epileptic movements, absence of spontaneous respiration when disconnected from ventilator, fixed dilated pupils not responding to light, no motor responses within the cranial nerve distribution, and abolition of all brainstem reflexes like corneal, gag, oculocephalic, vestibulo-ocular, and bronchial stimulation reflex. So these are the points from which we can we can say that the person is brainstem dead person. So what are the points? He or she must be in coma for at least 6 hours. Fine. So these are the points. Just read it once, and there should be no motor responses. Then and then only we can declare the person to be dead, because we have another concept of suspended animation also. Moving to next question, cadaveric spasm. Cadaveric spasm is also called as instantaneous rigor and cataleptic rigidity. Now don't confuse it with rigor mortis. It is instantaneous rigor, not rigor mortis. So what about cadaveric spasm? Write the definition. Instantaneous rigor is defined as the condition wherein a group of muscles which were in contraction at the time of death continue to be in the contraction or spasm even after death without the stage of primary relaxation. So in simple words, If some or the other group of muscles are contracted during the death or at the time of death, then after death also those are going to be in contracted state only. There is no primary relaxation. Therefore, this stage preserves the attitude or posture or state of the person at the time of death. Now, what are the preconditions? Sudden somatic death, a group of muscles in contraction spasm, that is an extreme activity at the time of death, extensive physical and emotional activity at the time of death. Mechanism is still not known. And now, what are the muscles involved? Any muscle who was before in the activity at the time of death, then that muscle is going to be in spasm. So, only the muscles which were in activity in the time of death go into spasm. Therefore, spasm is usually present in hands, but rarely whole body may be seen in spasm. After 2 to 3 hours, cadaveric spasm changes into rigor, which disappears after the decomposition. What is breaking off of spasm? It is almost impossible to break cadaveric spasm. What is the time required? Spasm results immediately on death. So what are the effects of cadaveric spasm? If the muscles of the hand get into instantaneous rigor, item held in the hand at the time of death remains tightly clenched in hand even after death, and it is almost impossible to remove it. Example, in a case of suicide, the weapon remains tightly held in hand even after death. And in case of homicide involving struggle, the hair or a piece of cloth of assailant remains tightly held in hand. So these are some of the examples which tell us about the effect of cadaveric spasm. The weapon remains in hand, the hair or piece of the cloth. So these are the things which help a lot as and works as medical evidence and act as medical evidence in court. Third point, in case of death due to drowning, a plant, stone or sand may be tightly held in hands. At times, sand present under the nails, fingertips may be abraded. And in soldier killed in battlefield, spasm may be in whole of his body. So these are the 4 points which we need to remember in case of cadaveric spasm. Now, what is the medical legal importance? Remember to write medical legal importance in every answer. To know the manner of death, whether suicide, homicide, accident. In case of homicide, identity of the assailant can be known. Yes, and third point is to know the attitude of the person at the time of death. So this was all about cadaveric spasm. Moving to next question, what is adipocere formation? Write the definition as usual. Adipocere formation is defined as the conversion of dead body into soft, fatty, waxy substance. This process is a modification of decomposition. So adipocere formation is nothing but a modification of decomposition in which there is formation of waxy substance. What is the mechanism? See, in simple terms, just understand remember two names or two terms. There is hydrogenation of the fatty fats in body, and there is hydrolysis and hydrogenation. Postmortem hydrolysis and postmortem hydrogenation of what? Of fats. So because of which fats are converted into fatty acids like stearic acid, palmitic acid, oleic acid, etc. And now these fatty acids attached with combined with calcium and ammonium ions, which ions? Calcium and ammonium, and because of which there is formation of insoluble soaps, and this is called as saponification. These soaps being acidic, these soaps are acidic because of which inside the body there is acidic environment, and we all know that in acidic environment there cannot be any bacterial growth. That is why there is preservation of body. So adipocere formation indirectly preserves the body, not indirectly, but it acts as it helps in preservation of the body. So normal fatty acid content is 0.5%, but in adipocere, after 1 month we find 20%, and after 3 months we find 70%. Now, what are the essential requirements? Absence of air, excess of moisture, and warmth. So ideally, adipocere formation occurs in dead bodies which are lying in water or in damp warm surroundings or buried in damp clay soil. I think you got this. Now, what is commencement? Adipocere formation starts in subcutaneous fat and is marked in areas having excessive fats like cheeks, breasts, abdomen, and buttocks. Slowly, the whole body, including muscles and internal viscera, change into adipocere. Finally, epidermis is lost, dermis darkens, small muscles get dried up, and also soft tissues dry up. It is possible that only a part of the body becomes adipocere and the rest may putrefy as routine. They're just trying to say what is commencement. More the fat, more would be the adipocere formation, nothing else. Now, what are the features? Body is converted into soft, waxy substance, floats on water, can be cut easily, melts on heating, burns with faint yellow flame, dissolves in alcohol and ether, emits sweetish disagreeable smell, and in early stages we have got smell, ammoniacal smell. Facial features are preserved. So facial features and injuries on body are well preserved, and therefore identification of dead body is possible, and cause of death can be known in case of death due to injury. Now, what is the time required? Adipocere formation does not occur in fetus less than 7 months. Very important point. Adipocere is well marked in fat bodies and bodies of mature newborns if the body is in water. Normally, adipocere formation occurs in 3 to 35 days. Once formed, adipocere preserves the body for many decades. So, these are the points in time required. Remember the point, adipocere formation does not occur in fetus less than 7 months. What is the medical legal importance? It is sure sign of death, obviously. Identity of the dead person can be known. Why? Because facial features are preserved. Then cause of death can be known in case of death due to injury. Time since death can be known, and place where the dead body was lying can be established. So these are the points in case of adipocere formation. Try to write down definition first, then mechanism, then requirements, commencement, and features, and time required, and medical legal importance. Every answer needs definition in FMT, then your mechanism if the question if the particular concept has got mechanism, then your features and medical legal importance. 4 points should be there in answer. Coming to next question, write about the stiffness in dead body. What are the conditions? Write about instantaneous rigor. So now you people tell me what is the other name of instantaneous rigor. As I said you earlier, other name of instantaneous rigor is cadaveric spasm, which is also called as cadaveric rigidity. Now, sorry, not cadaveric rigidity, it is called as, let me check once, it is called as cataleptic rigidity. I'm so sorry, because rigor mortis is also called as cadaveric rigidity, while cadaveric spasm is called as cataleptic rigidity. Remember the two names, instantaneous rigor or cataleptic rigidity. So moving with the question, stiffness in dead body, write the conditions causing and write about the instantaneous rigor. So we are not going to read about the instantaneous rigor, we will be just reading the rigor mortis. Now what are the other names? Cadaveric rigidity and death stiffening. So rigor is contraction or stiffening and mortis is death. So what is the definition? Rigor mortis is defined as contraction, stiffening, shortening and opacity of muscles after death. This change occurs after the molecular death. Okay. Now, just in simple words, they have asked you what is rigor mortis. Just write it is nothing but contraction, stiffness, shortening, and opacity of the muscle. Now, what is the mechanism of rigor mortis? Each muscle has fibers which have myofibrils, which are the contractile elements of muscles and are composed of protein filaments, actin, and myosin. So, in routine, actin and myosin filaments are present in interdigitating form. During contraction of muscles, they come close to each other. During rigor, actin and myosin fuse with each other, resulting in contraction, stiffening, and shortening of muscle. So, what they're trying to say, conventionally, we all know the sliding filament theory of muscle fibers. Actin and myosin have the tendency to, I'm so sorry for the background noises. Actin and myosin are responsible for the contraction of muscles. We all know that myosin head attached to the actin filament. What happens? Just recall the mechanism. We need ATP to release the myosin head from actin filament. That is why relaxation is possible. But in dead person, ATP depletion would be there. Obviously, there would be no ATP formation. So what happens? Myosin heads, myosin head do not get released from the actin filament, which leads to the contraction of the muscles, and this is the mechanism of rigor mortis. But now you may be asking, yes, if we all know that rigor mortis occurs after 2 to 3 hours and it lasts up to 12 to 36 hours. But why it lasts up to 12 to 36 hours if there is contraction of muscles, and why not for more time, or why not for decades like adipocere formation? The answer is there is decomposition of muscle fibers. So after the decomposition, how can there would obviously not be any contraction, because the muscle fibers itself they get decomposed, they get damaged. That is the reason why we say that rigor mortis lasts for 12 to 36 hours. Moving ahead and talking about the cadaveric spasm, we read it already. So this was all about the introduction, definition and mechanism. So what are the factors of rigor mortis? We'll be seeing ahead. Just in this slide, remember the definition and mechanism of rigor mortis. Moving ahead with the next question, we have also got, we'll cover the factors influencing rigor mortis here only. See, what are the factors influencing RM? Age, no rigor in fetus less than 7 months. Remember 2 points, no adipocere and no rigor in less than 7 months because of no glycogen. Rigor may be present in full-term stillbirth. Rigor appears early in children and elderly because of the less muscle mass. Sex, no difference. Condition of muscles, rigor appears slowly and stays longer in healthy and relaxed muscles. Cause of death, rigor appears early in death due to chronic wasting diseases. Rigor appears early due to convulsions in strychnine and tetanus poisoning. In strychnine poisoning and tetanus, and it appears immediately in insulin injection. So there are four conditions in which rigor mortis appears very early. Number one, children and elderly. But in case of death, regarding cause of death, there are four reasons, or there are four conditions. Number one, chronic wasting diseases, poisonings, convulsions, and tetanus, and you have got insulin injection and bacterial infection. So these are the four conditions in which rigor appears very early. And in which condition rigor is delayed? Paralysis, extensive hemorrhage, and asphyxia. Remember these conditions. Atmospheric temperature, heat favors rigor, increased breakdown of glycogen and ATP utilization, while cold delays rigor by double. So these were the factors. There are in total 5 factors which influence rigor mortis. RM, age, sex, condition of muscles, cause of death. In under that we have got 4 conditions, remember those, and atmospheric temperature. Moving to differential diagnosis of rigor. Rigor mortis can be confused with 4 things. What is differential diagnosis? Differential diagnosis is nothing but what do we say? Similar symptoms are observed. If all similar symptoms or signs are observed in more than 1 or 2 diseases, then those diseases can be called as differential diagnosis. Which means, I think you people got this. What do I mean by differential diagnosis? Differential diagnosis of rigor means what are the other conditions which resemble rigor mortis but are not rigor mortis in reality. So that is the term which we use for different. So that is what differential diagnosis is called. Rigor mortis can be confused with 4 things: cold stiffening, heat stiffening, gas stiffening, and cadaveric spasm. We learned about cadaveric spasm. Now we are going to learn about these 3. Number 1, cold stiffening. Due to exposure to cold, body becomes stiff due to freezing, solidification of fats and body fluids. Differentiation: in cold stiffening, temperature is usually sub-zero. On pressing the part, crepitations are heard. On warming the part, cold stiffening disappears due to melting, liquefaction of solid fats and fluids. What is heat stiffening? In body exposed to extensive heat above 65 degrees Celsius, there results stiffening and flexion at all the joints. This is called as pugilistic approach or boxers or defense posture. Very important point in heat stiffening. Always and always remember, in burns. Where do we find heat stiffening? Obviously in burns. And in burns we have got pugilistic or boxers or defense posture. So there is stiffening and flexions at all joints. Due to why? Now what is the reason? Due to denaturation and coagulation of proteins. It occurs in both an antemortem and postmortem burns. What is differentiation? In heat stiffening, lab examination shows altered proteins. Heat stiffening is much more intense than rigor and is therefore much more difficult to break. After few hours, rigor passes off, but heat stiffening is permanent. Other heat injuries are present and body may be in pugilistic attitude. So these are the points in case of heat stiffening. Now what is the gas stiffening or putrefactive? During decomposition, body part becomes rigid, and because of collection of gases in subcutaneous tissues, this is a very important question. In which tissues gases accumulated? Subcutaneous tissues, and the pressure exerted by these gases. So in decomposition process also, these gases help. What is differentiation? Other signs of decomposition are present. On pressing, crepitations are heard, and on incising, putrefactive rigidity disappears due to the release of gases. So these were the points about differential diagnosis of rigor. Next question: what are early signs of death? Enumerate. In early signs of death, we just have to read about eyes and skin. So it refers to the changes appearing in the dead body after 3 to 24 hours of death. The early and late signs of death are also referred as signs of molecular death. What are the changes in eyes? In total, we have got 8 changes, remember. Very first, reflexes. There is abolition of pupillary and corneal reflexes. Number 2, luster. The eyes loses its luster. Number 3, cornea. The cornea becomes dry, hard, hazy, opaque and lusterless. A temporary change occurs after 15 to 30 minutes of death, but it can be washed away. The permanent change occurs after 10 to 12 hours of death. Rarely these changes may be present even before death, like in uremia, narcotic poisoning, cholera, and sometime not occur after death in cyanide and carbon monoxide poisonings. So just remember that cornea becomes dry, hard, hazy, opaque and lusterless, and temporary change is observed after 15 to 30 minutes, and permanent change 10 to 12 hours after death. What about pupils? Pupils dilate after death. And what is the normal size? 5 mm. But for 1 to 2 hours, they respond to miotics and mydriatics. After 2 to 3 hours, any pressure on pupils changes its shape to oval, triangular, or polygonal. What is intraocular tension? Intraocular tension falls after death, and therefore eyeball sinks into the orbit. So normally it is 14 to 25 mm of mercury. Then immediately after death it becomes 12 mm of mercury. Half hour after death it becomes 3 mm of mercury, and 2 hours after death it becomes 0 mm of mercury. Now what is sclera? If eye remains open after death, there occurs deposition of dust on sclera leading to brown pigmentation, and this brown pigmentation is called as trachees noirs. Retinal blood vessels in a living. The retinal blood vessels are seen on ophthalmoscopy as a continuous line. This is the most important change in eye to calculate the time since death. So 1 to 2 hours after death it becomes dotted, 2 to 3 hours after death it becomes segmented, railroad appearance, and after, or say more than 3 hours, optic disc becomes pale. What about electrolytes? After death there is increase in the levels of potassium and ascorbic acid in vitreous humor. So these were the 8 points regarding eyes. Your reflexes, luster, then cornea, pupils, intraocular tension, sclera, then we have also got retina, retinal vessels, and yes, electrolytes. So these were the 8 points. Now what are the changes in skin? Color changes, obviously. After death the skin becomes greyish white in color. After decomposition there results greenish discoloration of skin due to formation of self-methemoglobin. Number 2, loss of translucency. After death, the skin loses its translucency and becomes opaque, as can be confirmed by examination of webs against the light. What is loss of elasticity? After death, there is loss of elasticity of skin. So, PM wounds don't gape. Now, what is gaping? Gaping is the increase in the size of skin edges of wounds. So, as the person is died, so there would be no gaping, which means the area of the wound would be less than that of the area of wound in a normal person or in a living person. That is called as no gaping. And also area pressed flattens because of loss of elasticity. And lips become dry, hard, and brown in color due to drying. So these were the changes in skin as well as eyes. We got 8 changes in eyes and 4 changes in skin. Moving ahead to our next question. What are the PM changes in eyes? We already read this. 8 points you have to write, and you have also write. You also need to write the what is early sign, meaning of early sign also. Coming to very important question, suspended animation. It is very important concept also, because it helps us to differentiate between a dead person and a living person. It confirms the death of person. So basically, if the person is died or not, we get to know with help of suspended animation. Other name is apparent death. In this condition, signs of life are not found as the functions are interrupted for some time or are reduced to minimum. However, life continues and resuscitation is successful in such cases. The metabolic rate is so reduced that the requirement of individual cells for oxygen is satisfied through the use of oxygen dissolved in body fluids. In freezing of the body or in severe drug poisoning of the brain, the activity of brain can completely stop and in some cases start again. Suspended animation may be produced voluntarily. Now, like yoga practitioners, they pass into trance, death-like in character. Involuntary suspension of animation lasting from few seconds to half an hour or more may be found in vagal inhibition, and this is the reason why there are certain conditions in which you find suspended animation and by mistakenly people, and so it is very important before issuing death certificate. Now what are those conditions in which it occurs? Number 1 is severe syncopal attacks. Number 2, vagal inhibition in newborn infants, in drowning, in electrocution, sunstroke, cholera, narcotic poisoning, after anesthesia, shock, hypothermia, and cerebral concussion, insanity, etc. So these points we should be learning carefully. The patient can be resuscitated by cardiac massage or electric stimulator and artificial respiration. This was all about suspended animation. What is the other name? Apparent death. Write the definition. What is it? In this condition, signs of life are not found as the functions are interrupted for some time or reduced to minimum. Moving ahead, what are the late signs? So what are the late signs? There are 3 late signs, and any sign which occurs after 24 hours is called as late sign. And there are 3 signs: decomposition, which is also called as putrefaction, then adipocyte formation and mummifaction. Now we all know what is adipocyte formation. Now we'll be learning about decomposition and mummifaction. So in decomposition, you just have to remember the definition, mechanism, and necessary conditions. Then the signs of decomposition, and yes, just a minute. Then what about decomposition in water, and factors influencing the rate of decomposition? So I know this is quite lengthy answer, but I'll try my best, sum it up for you. Very first and foremost thing, definition. What is the definition? The phenomenon due to autolysis and action of enzymes is called as decomposition. Auto is self breakdown. The enzymes of the body break down the dead into a dead body by causing proteolysis, glycolysis, and lipolysis. Heat favors autolysis, and extreme cold almost stops decomposition. Now, what are bacterial enzymes? They are aerobic and anaerobic bacteria like Clostridium welchii, Streptococcus, which act on the dead body by secreting enzymes like lipase and lecithinase. And to a little extent, fungi and insects also help. What are the necessary conditions? There should be absence of air, there should be warmth, and there should be warmth, there should be moisture, and air should be present. And in the absence of air, there results, yes, air should be present, because we all know in absence of air there is adipocyte formation, but in presence of air there is decomposition. And in the absence of moisture, dead body dries up and becomes a mummy. Process is known as mummifaction. So everything depends on the presence or absence of air. So what are the signs of decomposition? Color change, formation of foul smelling gases, pressure effects of gases, appearance of maggots, and other late changes. So very first change is color change. Earliest sign of decomposition is greenish discoloration of the body, seen in right iliac fossa first and then under the liver internally, because in cecum the content are more liquid and are full of bacteria. So in these areas it appears in 12 to 18 hours and slowly spreads on whole body in 24 to 48 hours. Greenish discoloration is due to the formation of self-meth hemoglobin. So hemoglobin on death becomes meth hemoglobin, then on H2S exposure becomes self-meth hemoglobin. Later color may change to purple, brown, bluish green, or even almost black. And secondly, the coloring matter HB dissociates from the RBCs. The HB dissociates, and it attaches to the walls of blood vessels, which leads to the then blood vessels appear as prominent lines, and this phenomenon is called as marbling. Formation of foul smelling gases due to the action of body and bacterial enzymes. There is formation of CO2, SO2, H2S, PH3, NH3, and methane. Gases are formed first in hollow viscera like stomach and intestine within 12 to 18 hours, and later in the whole body. Pressure effects. What are pressure effects? Bloating up of body in 36 to 48 hours. So body and face get bloated, eyes bulge out, eyelids, nose, cheeks, and lips become large greenish swollen mass. Tongue is swollen and protruded out of teeth. Breast and scrotum become large bloated masses. Penis becomes thickened, elongated, and semi-erect. Clothes may tear. In 48 to 72 hours, usually prolapse of rectum, uterus, and PM delivery in pregnant. What are the changes in female genitalia? They become swollen and pendulous, and prolapse of uterus and PM delivery in pregnant women. Lividity. Due to liquefaction of blood after 48 to 72 hours, site of hypostasis may change. Color of PM or staining changes to brown and finally black. What are the changes in skin and mucus? These are the all changes which we see under pressure. Number one is your marbling and color change. Number two is formation and foul smelling gas, pressure effects. Now we are learning about pressure effects. So bloating up, then changes in PM lividity, changes in female, changes in skin and wounds. So in 36 to 48 hours, due to collection of gases in subcutaneous tissue, there appear blisters called putrefactive. So putrefactive blisters can be confused with blisters due to scalds, that is burns due to moist heat. Putrefactive blisters mainly contain air, whereas blebs due to scalds contain serous fluids enriched in albumin, chlorides, and RBCs, and also base of scald blisters has raised papillae and epidermis shows inflammatory changes. Skin becomes loose, process is called as skin slippage. Skin cuticle can be easily peeled off, and therefore abrasions and contusions may not be visible. In 48 to 72 hours, skin from hands and feet can be removed as gloves, which is called as degloving, and stockings, destocking. Hair become loose and can be easily pulled out. Due to liquefaction of blood and pressure of gases, wounds appear to be again bleeding. Stomach contents and froth at nose and mouth. After 36 to 48 hours, due to pressure of gases on stomach and lungs, stomach contents, froths, and reddish fluid are seen oozing from nose and mouth. Emptying of heart. After 36 to 48 hours, due to pressure of gases, heart becomes empty. So these are the features regarding Pressure effects of gases, bloating up of body and features, changes in female genitalia, then changes in skin and wounds, changes in PM levity, and stomach contents and froth at nose and mouth, emptying of hearts, then rigidity also. Appearance of maggots, flies, example housefly, blowfly, green bottle fly, and blue bottle fly are attracted to dead body, and therefore within hours of death these flies lay their eggs in wounds. Exposed natural orifices, then exposed moist parts of body and folds of skin, neck, axilla, and inguinal area. In 1 to 2 days, these eggs change into larvae known as maggots. So the larval stage is seen on dead body as whitish crawling masses. After further 4 to 5 days, the maggots change into pupa, which converts into adult fly next 3 to 5 days. Therefore, adult flies will be coming out of the body after total 10 to 12 days of death. Fine. So, what are the other and branch of forensic medicine dealing with study of insects is called as forensic entomology. What are the other changes? Other late changes? In 3 to 5 days, the nails become loose and can be pulled out. The tip become loose and can be pulled out. Sutures of skull may separate and liquid brain may flow out from scalp injuries. In 7 to 12 days, which is colligative change, liquefaction of body. There is a softening and liquefaction of tissues of dead body. Internal viscera also liquefy. Body fats liquefy and become yellowish, translucent fluid filling the cavities, and thoraco-abdominal cavities may burst open. In 1 to 3 days, in 1 to 3 months, due to liquefaction, whole of the soft tissue is lost and body is reduced to skeleton, which is known as skeletonization of dead body. So in buried bodies, skeletonization occurs in about 1 year, but in normal dead bodies, in 1 to 3 months. Whole of the soft tissue is lost and body is reduced to skeleton. Finally, the bones also decompose. The time period depends upon the environmental conditions. Exposed bones decompose in 1 to 5 years, and bones in deep buried body more than 2 meters decompose in 25 to 100 years. Body buried in deep airtight coffin decompose after few centuries. So this was about the decomposition. Now we are going to learn about the decomposition of internal viscera. So decomposition occurs even of internal viscera, and changes are color change, blister appear in 3 to 5 days, in 7 to 12 days, and viscera with low density and high water content decompose early. So what we learned now was decomposition of external body. What did we learn? We started with definition, then we went to mechanism, autolysis, bacterial enzymes and fungi and insects, then we went to necessary conditions, and then science. So science for the important part, color changes, formation of foul smelling gases, pressure effects, appearance of maggots, and other late. In other late changes, we saw about skeletonization, and we also saw about what did we see? Nails, teeth, sutures of skull, and liquefaction. Now we are going to talk about the internal viscera. So color change. Initially, viscera became dark brown and finally almost black. Blisters appear. Liver appearance is known as honeycombed or vesicular or foamy. In 3 to 5 days, viscera are soft to touch and oily and greasy to feel. In 7 to 12 days, liquefaction of internal viscera occurs. Viscera with low density and high water content decompose earlier. Viscera to decompose early are larynx, trachea, stomach, intestines, spleen, liver, and brain. Viscera to decompose late are esophagus, pancreas, diaphragm, heart, lungs, kidney, muscles, blood vessels, uterus, prostate, and finally bones. This was about the decomposition of internal structure, that is viscera. Coming to decomposition in water. So what is sequence? In flowing water, head being the heaviest part becomes the dependent part, and therefore there is gravitational flow of blood and fluids into upper parts of the body. Sequence of decomposition of body parts in water is first head decomposes, then neck, then chest, then upper limbs, abdomen, and lower limbs. Sequence of decomposition in air is abdomen, then chest, then neck, then head, lower limbs, and upper limbs. Talking about rate of decomposition in water is half of that of in air due to low water temperature, less air, flotation earlier in shallow water due to heating effect of sun rays, and flotation earlier in salt water because of high specific gravity of salt water. So what they are saying is rate of decomposition in water is half of that in air. That means decomposition rate in water is slow. But we learned what it rate of decomposition in water is half of the rate than in air, and we know that rate of adipocere formation is highest in water, 4:2:1. What are the factors influencing rate of decomposition? See, there are external factors, internal factors. External factors, warmth, air, moisture, clothes, surface injuries and manner of burial. And internal factors, age, sex, condition of body, internal injury and cause of death. Quickly we'll be reading this. This is very lengthy answer, but you just have to remember the headings. External factors in warmth, ideal temperature for decomposition is 37 degrees Celsius, temperature around 0 degree and more than 50 degrees retard decomposition. Rate of decomposition is almost double in summer. Air is essential for decomposition, therefore, in absence of air, no decomposition occurs, that the body becomes adipocere. Moist and stagnant air is more favorable to decomposition. Rate of decomposition is slow in water and buried bodies due to exclusion of air. Yes, there is no air in water, that's why decomposition in water is slow. Moisture is essential for decomposition, and in absence of moisture, body becomes a mummy. Viscera with higher moisture content decompose earlier. Decomposition is faster, double than in air in the body removed from the water. What about clothes? Initially, clothes favor decomposition because of entrapped air and retention of body heat, but later, clothes retard decomposition because of protection of body from flies and atmospheric air. With tight clothing like socks, shoes, belt, tight undergarments, etc., decomposition is slow because of exclusion of air and compression of tissues. Surface injuries due to mechanical violence or animals favor decomposition. Manner of burial: decomposition is slow in deep buried and if body buried in airtight coffin. Decomposition is slow if buried immediately after death. Decomposition is slow if buried with lime or in dry sandy soil. It is more in shallow and damp grave, especially in body without clothes and without coffin. And a rate of decomposition is called as Casper's dictum. This is a very important question. Air is to water is to removed from water is to buried. 1 is to half is to 2 is to 1 by 8. So 1 highest is in air, then half is in water, then removed from water it is 2. Fine. And then in buried it is 1 by 8. What are the internal factors? Age. Decomposition is very slow in stillborn and newborn who has not been fed because body is almost sterile. Decomposition is faster in children. Decomposition is slow in old people, less muscle and less moisture. Sex, no difference, though excessive fat favors decomposition by retaining heat. Condition of body: decomposition is slow in thin, lean and weak, less fluids. Internal injuries favors decomposition. Cause of death: decomposition is slow in chronic wasting diseases. It is faster in asphyxial deaths due to congestion of viscera. It is faster in deaths due to bacterial infection. It is slow in death due to heavy metal poisoning because they preserve the body. And it is slow in death due to poisoning by carbolic acid, heavy metals, datura, strychnine. They do not allow the growth of bacteria and so resist decomposition. What are the medical aspects of decomposition? It is the surest sign of death. Time since death can be known. And advanced decomposition have obliterates the identity and obliterates the cause of death. So decomposition obliterates while adipocere preserves. Remember. So this was about the late signs of death. What did we learn? We'll just recap once. We learned about the definition of decomposition. See, here you have to write about definition, then mechanism, autolysis, bacterial enzymes and fungi in insects, the necessary conditions, presence of air, moisture and warmth. And we learned about the signs, color changes, formation of foul smelling gases, pressure effects of gases, then appearance of maggots and other late. In other late changes, we learned about the, what did we learn? We learned about the skeletonization. Fine. Then we also learned about the liquefaction. Then we learned about the decomposition in water and decomposition of viscera. That is when to presume a person has died. Presumption of death is required in cases of inheritance of property, insurance claims and pension claims. As per section 107 and 108 Indian Evidence Act, if a person is shown to be alive any time within the last 30 years, law presumes him to be still alive and the burden of proving him dead is on the person who states so. But if the relatives and friends allege that they have not received any letter or communication from him which they were receiving and should have received any time within the last 7 years, law presumes him to be dead and the burden of proving him alive is on the person who states so. So no presumption is made about the time of death. Presumption of survivorship. In cases of inheritance of property based upon will, it becomes essential to establish who survived whom, that is, who died earlier, in case of both of them died in the same incident. Obviously, most important is the evidence of eyewitness, in whose absence the following are the guidelines to presume who survived whom. Age: an adult survives longer than a child or elderly. Sex: male survives longer. Condition of body: healthy and well built survives more than weak. Extent of injuries: more the number of severity of injuries, earlier the death. Death is earlier if injuries are on vital organs or major blood vessels. Time since death as established during PM examination. Type and cause of death: in starvation, females survive more, old survive longer. In asphyxial, females survive longer. In cold, adult survives longer. Since death, and we are going to see what are the different parameters which we will use in estimating time since death. So, during post-mortem examination, it is essential to establish time since death so as to know the approximate time of death. Time since death may not be the time of crime because the individual may have survived for some time after the crime. In case it is not hospital death and if there is no eyewitness, it is almost impossible to determine the exact time of death or the exact interval between death and PM examination. However, if the body is not preserved, an approximate idea can be had from the following. So they are just trying to say if the body is not preserved, then the approximate, we can find out the time since death by approximate method by using rigor mortis, algor mortis, livor mortis and decomposition. So in the introductory part they are trying to say that it is very difficult to find out the exact time since death because the person may have survived a few minutes or few seconds or for some time before the actual crime. Now we are going to study about the parameters which help a lot in calculating time since death. So the very first parameter is cooling of body, which is also called as algor mortis. After death, body loses heat by conduction, convection, radiation and evaporation and thus tries to attain the atmospheric temperature. The external surface of body cools in 12 to 15 hours and internal viscera cool in 18 to 24 hours. Considering the average rate of cooling in India to be 0.5 to 0.7 degree. We read it already. So from cooling of the body, which is algor mortis, we can find out the time since death. Now, PM lividity. Due to stagnation of blood in toneless dilated capillaries on dependent part of the body stains bluish purple. PM lividity starts appearing after 1 hour, becomes established during 3 to 6 hours and get fixed after 6 hours. So by PM lividity also we can find out the time since death of the body. If the stain is fixed, then we can say the body died 6 hours ago only. The person died 6 hours ago. If it is not established or it just started to appear, then we can say the person has died recently before 1 hour. What about rigor mortis? Due to non-availability of ATP because of depletion of glycogen stores, actin and myosin filaments fuse with each other to form a gel, resulting in shortening, stiffening, rigidity and opacity of muscles. Rigor mortis starts appearing 2 to 3 hours after death, becomes established in 12 hours after death, remains for next 12 hours and then slowly passes off in the next 12 hours. So in simple words, rigor mortis stays up till 12 hours to 36 hours and it occurs after 2 to 3 hours after death. What about decomposition? In presence of moisture, air and warmth, see, for decomposition you need air. For adipocyte formation there should be no air. The body and the bacterial enzymes act on body, resulting in conversion of complex organic matter into simple inorganic elements so as to cause softening and liquefaction of the dead body. This change starts in body after 2 to 3 hours, becomes manifest between 12 to 24 hours and is fully established in 2 to 3 days after death. So decomposition occurs 2 to 3 days after death. Now, what are the changes in decomposition in less than 1 day? So these are the days given, changes of decomposition in less than 1 day, 1 to 2 days, 2 to 3 days and 3 to 5. Then adipocyte formation, mummification, these are the other parameters. So as we are talking about the decomposition, we need to know that the subunits in decomposition is less than 1 day, 1 to 2 day, 2 to 3 days, 3 to 5 days and other late signs of decomposition. Starting with less than 1 day wala subunit, greenish discoloration seen first in right iliac region, then intestinal distension. Flies lay their eggs in natural orifices, wounds and in body creases or folds. Then in 1 to 2 days, what we'll observe? Greenish discoloration of whole body, marbling. Marbling is observed in 1 to 2 days. Remember, this is MCQ. Foul smell, bloating of the body starts, putrefactive blisters, skin slippage, pressure effects of gases. In 2 to 3 days, we have whole body discolored and bloated. Very foul smell, maggots are present. Maggots are present in 2 to 3 days. Cuticle can be peeled off, hair can be peeled off, maybe prolapse of rectum and uterus, maybe PM delivery in pregnant. Wounds appear to be bleeding again, shifting of PM lividity, heart becomes empty, froth and gastric contents present at nose and mouth. What happens in 3 to 5 days? Teeth become loose and can be pulled out. Nails become loose and can be pulled out. Sutures of skull separate and therefore liquefied brain may ooze out of the scalp injuries. And liquefaction of internal viscera starts. And what are the other signs? Body cavities may burst open, colligative decomposition, which is liquefaction of body occurs, whole of the soft tissue liquefies slowly, and finally skeletonization of body occurs in 1 to 3 months. Bone decompose in few to many years. So under decomposition part, you have to divide decomposition into less than 1 day, 1 to 2 days, 2 to 3 days, and 3 to 5 days. And in fifth part is other late signs of decomposition. Now the next parameter after decomposition is adipocere. So what were the parameters we learned now? Number 1 was cooling of the body. Number 2, PM levity. Number 3 was your rigor mortis. Number 4 was now decomposition. Number 5 is adipocere formation. So in a body lying in water, in the absence of air, there results PM hydrolysis and hydrogenation. And we all know how adipocere formation takes place. So the time duration is important. It is 3 to 35 days. What about mummification? 3 to 24 months. Absence of moisture and excess of warm air, body mummifies in 3 to 24 months due to dehydration. This is important. Now, what are the changes in bones? Soft tissue is lost after 1 to 3 months. Bone marrow is moist up to 3 months. Bone marrow dries up to 6 months. And bones decompose in few many years. Then what are the changes in bone marrow? Even though if we'll mention up to changes in bones, that would be fine. So we'll just quickly go to contents of, so we'll just read the headlines. I mean the title. Changes in bone marrow occurs. Contents of stomach and large intestines are hampered. Basically liquefaction takes place. Contents of urinary bladder and biochemical changes. So in CSF we observe increased NPN. What is NPN? Non-proteinaceous nitrogen substances. So all in all, if you'll be writing the headings also, if you'll be reading the headings also, then it's quite okay. You have to write about the time since death introduction. Then you have, if you can draw this graph, then it would be impressive. But do not forget to mention the first 5 parameters: cooling of body, algar mortis, levity, ligor mortis, then rigor mortis also, and your fourth point is decomposition. Fifth point would be adipocere, and sixth is mummification. So these are the parameters which help us to identify the time since death of that particular body. Even if you'll write this much, that would be more than enough. And they have just described it. Yes, so this was all about this question regarding parameters of time since death. I don't think too much detailed answer is given here, but just mention the mention the 6 parameters until mummification, and that would be okay. We have completed forensic thanatology important questions, and next video would be on asphyxial deaths. So I hope you people enjoyed this lecture. Just try to revise with me, and we are good to go for the next session then. Until then, keep learning, keep growing. Bye.